What used to be routine, what was it, 4 or 5 months ago, going to work or school, seeing friends, even grocery shopping, has changed so much during this pandemic. And add to that, for almost everybody, some level of financial stress. Well, today, the Health Minister, Patty Hajdu, expressed huge concern for the mental health of Canadians. So while physical distancing and masks can help stop the spread of the virus, or at least slow it down, what can we do to take care of our mental health? Well, with some guidance tonight is Dr. Chang, a psychiatrist and author based here in Vancouver, and Dr. Thomas Unger, psychiatrist in chief at St. Michael's Hospital in Toronto. We got a lot of questions. We were actually overwhelmed by the number and depth of them. And Dr. Chang, let me put the first one to you. Our daughters are nervous about going back to school. They ask me, why is it okay they go into a school building in September, but Dad doesn't have to go back to his office downtown? I don't know how to reassure them. Dr. Chang, what would you suggest?
Well, that's a very good, curious question, smart kids. I would say that, first of all, we want to be truthful, optimistic, and make sure we reassure students and children that the adults are planning and in control, because children experience anxiety more. Let them know that there are protocols between public health and school officials, but remind them that they may not be perfect, that they have a voice to express any concern or caution, and to work collaboratively with their teachers, administrators, and most of all, their parents and caregivers, that you will be there to help guide them, and with a tone of optimism. This is a stressful time for everyone, especially young people.
But Dr. Chang, you deal with children all the time here in Vancouver and as an author as well. And I guess one of the challenges, and I saw this last night on the National, with some parents who, right or wrong, don't have confidence in the back to school plan. So how do they deal with their children when they themselves are anxious?
Right. And I think so being truthful is totally fine. Children can sense if you are concerned, and so you don't want to lie. So if you do have concerns, express exactly what they are. Don't give them a laundry list of things that they can't do anything about. And then quickly turn to practical solutions. Say, you know what, I'm not quite sure social distancing has been figured out. This is what I would like you to do. I'm going to give you this noodle and you can measure your space, or let's practice the mask or hand washing. So be very specific and practical at this point with young people, and try not to overwhelm them with your own individual concerns.
Dr. Unger, next question to you. I think twice about leaving home and going out in public, and I'm on edge whenever I'm out in public places. I've certainly heard people say things like that. You probably have too. What's your advice?
Yeah, so this is a weird time. If you're not worried, there's something wrong with you. So you got to validate it's normal to be anxious and worried. It's based on reality. There's nothing unusual about that, but that doesn't make it an illness or anything. It just means we have to acknowledge that, accept that, and then to hide out and have the anxiety overwhelm you and paralyze you if we're now allowed out and we're being increasingly allowed to go out and start doing things. It means it's time to begin dipping your toe in the shallow end and gradually moving on and getting used to a manageable amount of anxiety. And it'll get a little better. You know, it's really scary at the beginning, but you go with your comfort level, you start exposing yourself, because we have to learn to live with the anxiety and to live with the reality in as safe as possible a way as we can. So I would just acknowledge it, validate it, but then encourage them to begin starting to gradually get out there to the degree that they can comfortably do it, because it'll get a little bit better and better as they gradually expose themselves over time.
And Dr. Unger, let me put the next question to you as well. The pandemic has been absolutely horrible. I was raised to be a good, hard worker. Having my job taken away from me has caused endless amounts of anxiety. I want my job back.
Yeah, so that I really feel for people like that. I mean, this really sucks. It's got significant potential economic impacts and work impacts for a lot of people. And that's just a real harsh reality. So I understand how upset they'll be, down and sad. If you're really negative and really feeling down and nothing gets you out of it, then I think you need to go get checked out. Contact your health provider, family doctor, mental health hotline, because there's a slight chance that that regular down that you're supposed to feel because of the difficulty can actually slide into a mental health or medical condition we call depression. So if you're too despaired, please get checked out.
And Dr. Chang, we have about 30 seconds left, but kind of on that theme for those people who just are feeling, maybe it's not even overwhelming anxiety, but just nervous about getting into any kind of routine at all, your word to them?
I would agree with Dr. Unger. I think that there is this concept of pandemic fatigue, like a precursor to mental health symptoms. They're characterized by sleep disturbance, irritability, anxiety, a feeling of loneliness. Be careful, be watchful for those, and basic self-care, routine, regular sleep, routine, regular movement, exercise, and social connection. It's not socializing, but social bonding. Be very aware. We need to flatten the mental health curve and really help Canadians get through this difficult time.
I don't say this glibly. It actually is comforting hearing from both of you. And there are lots of questions we didn't get to, so hopefully we can do this again. Thank you very much.
Thank you.
My pleasure.